To begin, I need to have an order to place an NG tube. I will say today that my patient has difficulty swallowing and weight loss and is going to have an NG tube for medications and feedings. I will begin by checking my order. Now I will gather my supplies to take to my patient's room. I need a cup of water with a straw for my patient to sip during insertion of the tube. I need my NG tube, a lubricant, a pH strip or litmus paper, a measuring tape, a 60 ml syringe. This is my bottle of water just for irrigation. Tape, a non-sterile drape to protect my patient's gown, pen light, non-sterile gloves, a basin. You will also note that I am wearing personal protective equipment. Today I'm wearing my yellow gown. I would wear a mask with a face shield to protect my eyes since I'm going to be potentially coming into contact with gastric contents, but for demonstration purposes I will set this to the side. I will begin by entering my patient's room, washing my hands, introducing myself. I will find my patient's identification bracelet and ask him to state his name and date of birth. Next, I'm going to talk to my patient and explain the procedure. I'm going to raise the bed to a position of comfort for myself for working. And I'm going to assist my patient in the bed to sit all the way in a high Fowler's position, 90 degrees. I'm going to put my side rail down. I will place my non-sterile drape across his chest. I can give him a basin to hold in case he has nausea or vomiting. I want to perform a thorough assessment on my patient before I insert my NG tube. I would begin by asking my patient if he's had nasal or sinus surgery, if he's had a fractured nose, deviated septum. I'm going to take my pen light and check both nares to make sure that they're patent. And it looks like on this patient, I will go through the left nair. Other considerations for not placing the NG tube would be a patient that has had gastric bypass surgery, with esophageal varices, alcoholism, liver disease, any bleeding disorders. So that is part of our thorough assessment. I'm also going to ask my patient if he could take sips of water during the insertion of this NG tube, that will assist with passing the NG tube more easily. I will go ahead and open my tube, and I'm going to move my basin for demonstration purposes. And I'll open my lubricant. I must measure my NG tube so that I will know how far to place it. I will do this by pulling up this gown. I'm going to measure the tube, and I'll turn his head slightly for demonstration, from the tip of the nose to the tip of the earlobe to the xiphoid process. At this mark, I will put a piece of tape, and that will tell me how far to insert my NG tube. I also want to tear a piece of tape to use to secure my NG tube to my patient's nose once inserted. I'm going to tear a piece maybe 3 to 4 inches long and split part of it in half so it looks like a pair of pants. I also am going to tear 1 extra piece of tape to secure my tube. I'm going to put my gloves on. But I want to lubricate the first 2 to 4 inches of the nasogastric tube to help it pass more easily. I'm now going to place a cap at the end of my NG tube in the clear portion. And now I'm ready to insert my nasogastric tube. I'm going to give my patient his water and ask him to take sips of water when I prompt him. I'm going to begin by inserting my nasogastric tube with the patient's head either in a neutral position or slightly extended. Using a steady motion, I'm going to insert until I meet resistance. Once I meet resistance, I'm going to ask my patient to touch his chin to his chest and to take sips of water, and I will have an assistant and I will ask him to swallow, 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 inserting the NG tube as my patient is swallowing and the tube is passing to the stomach. When I've reached my tape mark, thank you. When I've reached my tape mark, I'm going to secure my tube with my tape that has the pants by placing the waist of the pants on the nose and taking the pieces and wrapping around the NG tube.